I'm Brandon.
I'm Amelia.
We're Martin and Wilson's parents.
And Martin and Wilson have Duchenne muscular dystrophy.
In early 2018, when Martin was 3, he was having some growth issues, and his pediatrician did some blood work. After his liver enzymes came back elevated, the doctor referred us to a gastroenterologist who discovered that Martin most likely had muscular dystrophy. A few days later, we had our 5-month-old Wilson tested, and he was confirmed to have it as well. A few months later, a DNA test confirmed that the boys have Duchenne muscular dystrophy. We had no family history, but once we knew that we had 2 children with DMD, we learned that Amelia was also a carrier for DMD.
Very soon after diagnosis, we connected with the MDA, and it was instrumental in helping us access specialists who could provide proactive care that would give Martin and Wilson the best treatment opportunities. An MDA neurologist connected us with a clinical trial in the same year that our boys were diagnosed. And because of her quick intervention, Martin and Wilson began taking an experimental treatment that helped slow the progression of DMD.
Ever since our diagnosis, we had heard about MDA summer camp. And this past summer was Martin's first time to attend MDA camp. He went to Camp for All, which is in Brenham, Texas. He went ziplining, horseback riding, and he navigated a ropes course. He made lifelong friends and lasting memories. And he got to enjoy new experiences in a fully accessible environment with his peers. No activity was off limits due to safety or difficulty. At MDA camp, his condition didn't determine his experience, and we didn't have to worry about him getting the care he needed because they were skilled professionals who knew all their needs.
In April of 2023, I started having frequent heart palpitations, and one day while I was working from home, I passed out and I began experiencing shortness of breath. So I decided to go to the hospital. I had recently learned that carriers could have heart-related problems because of Duchenne, and I was concerned. So I went to the hospital and I stayed there for 9 days. Ultimately, they determined that I had heart failure with reduced ejection fraction due to my DMD carrier status. The doctor said I was at extremely high risk of cardiac arrest, and I wore a defibrillator for 9 months in the event that my heart stopped. So I completed cardiac rehab. I am on a whole host of medications, and I'm doing a lot better thanks to these advancements in medicine and doctors with knowledge of how carriers are also affected by DMD. The MDA has contributed to the research and awareness that help other carriers have better health outcomes. On December 9th, Martin will receive an ELEVIDYS infusion, which is the first commercially available gene therapy for the treatment of DMD. And we're so grateful for all the work that the MDA has done to bring about this life-saving drug. Unfortunately, Wilson is not eligible for ELEVIDYS. He has elevated antibodies that exclude him from receiving it. However, we're hopeful that scientists and researchers will find a way for Wilson and others like him to receive the treatment, and for patients to be dosed more than once if needed. There are trials in process as we speak, and the MDA supports the development of these life-saving therapies through clinical trials and cutting-edge research. The future's bright, and we're grateful for the MDA's contributions.
Over these past 6 years, our family has been through a lot. It's been a journey filled with anxiety, grief, frustration, and fear. But it's also a journey filled with learning, growth, perseverance, and joy. Yes, even joy. We've learned to cherish our family more deeply and appreciate everyday moments more intentionally. We laugh a lot, we cry a lot, and our eyes have been opened to what life is truly all about. Amelia and I have become advocates not only for our own children, but for other families in our community. We believe that sharing our story, our knowledge, and our experience can help others find strength and support as they navigate a journey that no one wants to take.
Your support of the MDA brings life-giving treatments to children like ours, helping to slow progressive conditions and prolonging their health and independence. With breakthrough therapies, our children are living lives filled with possibilities. Through programs like summer camp and virtual game nights, people with neuromuscular diseases find friendship and support and joy, which are key to living healthy, happy lives. The MDA changed our family's life. So please help them continue to change the lives of families like ours through your contributions. Thank you.